Today's discussion is on palpitations due to a fast rhythm originating from the upper chambers of the heart. Palpitation due to a fast rhythm from the upper chambers of the heart can be regular or irregular. Regular fast heartbeats from the upper chamber is known as supraventricular tachycardia or SVT in short. A fast irregular palpitation due to abnormality in the upper chambers of the heart is known as atrial fibrillation. Chance for atrial fibrillation increases as the age advances. It can also occur after an alcoholic binge, holiday heart syndrome. Supraventricular tachycardia is seldom fatal and can often be terminated easily in a cardiac care setup with medication. Sometimes it can be terminated even without medications by a cough, strain, or a gag reflex, or a splash of ice-cold water over the face. Another method which emergency medical personnel use to terminate the episode is by giving a pressure over the pulsating blood vessel in the neck. But this should not be attempted by a lay person as it has its own risks. Carotid sinus massage, as it is called, should be done carefully, ideally with ECG monitoring in an emergency care setup. If supraventricular tachycardia is left untreated for a long period, it can cause weakening of the heart muscle, leading to fall in blood pressure and heart failure. Recurrence can be prevented by medications taken on a long-term basis. Some with very infrequent episodes also opt for a pill-in-the-pocket approach by taking a tablet as soon as the symptom occurs. Curative treatment these days is in the form of identification of the site by cardiac electrophysiology studies and radiofrequency catheter ablation. In this procedure, small multi-electrode catheters are introduced into the heart, monitoring the electrical signal from each location. The procedure is done under local anesthesia from the groin and neck. Once the exact site of the abnormality is localized, a radiofrequency signal, type of signal used in mobile phones, is delivered to cause a tiny controlled superficial burn which stops the abnormal electrical activity within the heart. This procedure has a fairly high success rate and few complications, and hence is being resorted to by most persons to avoid the problems of taking long-term medications. Atrial fibrillation, the irregular rhythm from the upper chambers, is a bit more difficult to treat. It can either be treated by controlling the heart rate with medications or reverting to normal rhythm by medications or rarely with a medical direct current shock. Like supraventricular tachycardia, atrial fibrillation can also be treated by radiofrequency catheter ablation, but the success rates are lower and there is possibility of recurrence. Another problem with atrial fibrillation is that it can lead to clot formation inside the heart. These clots can move out and block blood vessels elsewhere, leading to stroke and other disorders. So, persons with atrial fibrillation may be given medications to prevent clot formation within the heart to prevent stroke. This needs regular monitoring of clotting function.